My name is Sara Flores. I'm currently and have been living in St. Louis for the past 15 years. Currently, I am a birth worker, a lactation consultant, a full spectrum doula, reproductive justice activist, and that all comes from the roots of my previous experience and work as a union organizer. 2022, I found out I was pregnant with my third child. Um, and it was a difficult pregnancy. With the past two experiences with birth, I had midwifery care. This time, I was really focused in on trying to have a home birth. It's actually my second attempt. During that time, though, I was also receiving care within the medicalized system through the Mercy Birthing Center, which is midwifery run. I went to Mercy specifically because it's in my insurance plan. And there are many other hospital systems that I cannot go to. So always as a backup plan, because birth is unpredictable, I had established care at Mercy so that in case I needed a transfer, I would be able to do that and have my insurance covered. The birth was long. I tend to have very long births. It was hard. And it lasted 3.5 days, which as a birth worker, I'm like, that happens. But what was so hard is what came afterwards. When I had my third child, Zephyr, he came out and immediately I knew that something wasn't right. He sounded like he was gurgling. He didn't have that big, bright, heavy, loud cry. And it sounded like there was just so much fluid in his lungs. He ended up having a pneumothorax. And he was in the hospital for 3 days, the NICU. We were able to work with that care team to make sure that he got the care he needed and got strong enough, his lungs got strong enough that we could leave and go home and start becoming a family of 5. What I didn't expect is to get about 5 months, 6 months later, a bill from the, I want to say the neonatologist billing services for that NICU stay. We had made sure that we went to the hospital that was in our insurance network, and we got a bill for almost $13,000, which is laughable. It might as well be $1 million. Like, we are not in a position to pay that kind of money. And especially since we have been so intentional about making sure that we were not incurring any extraneous medical costs. So I reached out to get some guidance because there's no way that we can afford this, and my insurance just categorically denied it. As a parent, to begin with, I feel so unsupported through the systems that we have. I'm very lucky that I have family members who are able to support us, but when it comes to like the financials of having children, or even just being able to have kids, it feels so difficult. And then after this completely uncontrollable situation, it just felt like a slap in the face that we had no insurance coverage for an absolute medical emergency. In 2023 alone, Anthem BlueCross BlueShields, Elevance, took in, it's an obscene amount to even say out loud, $8.5 billion. My experience to make sure that my baby got the care he needed is less than $13,000. I mean, that's got to be what, like half a second for them in profits. It's dehumanizing, and We're talking about a baby. The president of Blue Cross Blue Shield and CEO, Gail Boudreaux, she in 2023 alone, her compensation was $21.9 million. That's $21.9 million to make decisions that deny people life-saving healthcare every single day, including my child. $21.9 million to make sure that we, family of five, would have to pay $13,000 for the necessary medical care for my child. Good job. People are denied care by private health insurance well over 248 million times annually. Sometimes that's for really small things, but then it's really big charges and really big things like your life or your child's life, limbs, the ability to have healthcare so you can work, and having those life-changing and necessary procedures and healthcare denied is so profoundly damaging. That means that people are not able to support their families, their children, their babies, help their communities. These are people who are vital to every part of our communities. And nickel and diming folks just because they have the bad fortune of not being a millionaire to afford top-notch health insurance is just completely un-American and inhumane. I'm calling out to Anthem BlueCross BlueShield, and I'm calling out to Gail Boudreaux to cancel this debt. It is well within the means of this billion-dollar corporation that profits on the healthcare of everyday people. $13,000 for emergency care that we weren't even given an option to choose is categorically unfair and unjust. And to put that all on us because we were so vulnerable trying to get the best care for our newborn baby because he had the misfortune of having a hole in his lung is absolutely disgusting. I also put a call out to our elected officials, policymakers, and most importantly, just my everyday citizens, my community members, my brothers and sisters who are just out in the streets trying to have their families survive, that we really need to use our voices and say, profits over people is evil. This health insurance system is so profoundly broken. And just even one change to make it so that having a medical emergency, a medical emergency should not put you at such risk that your family could go into deep poverty, deep debt. Something needs to change.